I'm delighted to welcome back into studio Professor John Nolan, who has made amazing leaps and bounds in the world of eye health over the years. He's no stranger to WLR because he's always involved in something really exciting. One of the latest things he is involved in is Supplement Certified. He's a co-founder, and this is a company, I suppose, that was born in SCTU in the Nutrition Research Centre of Ireland, and it now is a company that has 6 people and growing. Good evening, John. How are you?
Good evening, Mary. Thank you for having me again.
Yeah, it's great to see you again. Always great to see you because you're always working on brilliant things. And you know, we don't really have time to delve into the background of everything you've done, but I do like to give listeners a chance to get an overview of a person in case they're not familiar with you. So can you give a very brief history of your career to date in eye health?
Absolutely. Wow, it's nearly 25 years old now, wow. Believe it or not. Yeah. So I'm a scientist, I'm a nutritional scientist, and I'm, very proud that my scientific career began and is now hopefully concluding here in lovely Waterford now at our university. But yeah, I work and have worked with nutrients for human health for a long time, and we've been working primarily with nutrition of the eye and nutrition of the brain. And I suppose my job at the moment is to continue to be a scientist and to develop kind of research questions that allow us to do research that helps people see better and allow and hopefully protect eyesight and protect brain health and functions around those. And I call that Health 3.0. And I do that through our university centre, which is the Nutrition Research Centre Ireland. I'm working with people from all disciplines of eye health, nutrition, statistics, you name it. We have such a multidisciplinary team and have had over, now many decades. And I suppose in the first instance, my own PhD was working with a disease called macular degeneration, which we can come back to in a while maybe. But it's amazing to see how all that research has evolved into questions where we now look at brain health, but also even in general society, how well we see what is a new normal vision. Why does that matter for drivers or for sports people or for you, Mary? It's for everyone. And the reality is we know and have identified what's good in good nutrition that is working inside our body, in our cells of the eye and brain, that almost act like sunscreen there. So essentially we conduct research, we publish scientific papers, we create innovation that's, has like intellectual property protection that the university works with and benefits from. And in this case, Supplement Certified, which is another type of intellectual property, which is a spin-out business from the university.
Yeah, and I'm really looking forward to talking about this because, I've often covered this with various different people who would have, I suppose, grown an idea, for want of a better expression, out in the college, and then it goes through the commercialisation process and it becomes a business, and it's a great story of evolution, I think. And Supplement Certified is a very good example of this because you are now a viable commercial business, I'm right in saying.
Yes, so this is a spin-out business that has, as you rightly put, has come through our technology transfer office at the university, and it actually exists because we had a problem in research. So it exists because when we were doing a trial many years ago, Alfonso, who's a co-founder of the business, and we saw something in human blood that we didn't expect. So if you think of it from the supplement perspective, the concept is you take a supplement, it claims an active ingredient. So in eye health, that's like nutrients called carotenoids. And then us scientists are able to measure that. So I might be able to take your blood sample, Mary, and I'll put it on a very detailed system called a HPLC, and we'll have special methodology where we can say, okay, Mary's taken this supplement and here's the amount of lutein or mesozeaxanthin that you have. And
would that have to be done very quickly after taking the supplement?
No, not at all. These supplements kind of, when they go into your stomach, the pathway for supplements is interesting actually. So you consume them.
Yeah.
Now there's 2 types. You can have water soluble, which are kind of they're easily kind of brought into our biological systems, but they are water based, so they're water soluble. And then you fat soluble, which a lot of the nutrients of the eye and brain would be fat soluble, which means that they just have a different kind of matrix in which they have to go through to get in. But to answer your question, we don't have to measure it very quickly, because I always describe the blood system as the taxi system. Taking up and transferring these bioactive nutrients to the target tissues, such as the eye and brain. So Mary, if I was to take your blood today, and let's just say you've never taken a lutein supplement, I'll see normal lutein levels that are unique to your diet. So if you're eating spinach or egg yolks, you'll have a certain amount of lutein, or peppers, all these wonderful foods. But if I give you a supplement, in theory, if that supplement contains the lutein or the mesozeaxanthin, that amount of that nutrient should go up in your blood. And we'll see that as quickly as 10 days after taking the supplement. We call this the half-life. So it takes a period of time. But what we have to do is take the blood sample, and then we have to do an extraction procedure, and then we have to quantify it on a very sophisticated system where it's calibrated and you're comparing it to standards, basically. So what we found, in the reason why Supplement Certified exists, was that we were doing a clinical trial, and when we were looking at the bloods, we saw that one of the patient groups had a carotenoid present that we didn't think was in the supplement.
Oh, okay.
And I said to my scientific team, I think we may have mixed up, there may be a mislabeling, or something must have happened, because all of these patients had this particular carotenoid present that wasn't, in theory at least, in the supplement. And we actually spent ages checking the data, checking the databases, checking the labelling. And what did we find? We found that it was actually Alan Howard, who was from the Howard Foundation, one of the scientists I was working with, said, well, let's look at the supplement. So we looked at the supplement, and we saw that this supplement had a nutrient present that wasn't claimed on the label.
Oh, and why would that be the case?
So hence now the can of worms. And then you look into the regulatory environment around food supplements and what's going on there. That would be the case, because what we now know is that a lot of the regulation around food supplements is self-regulation. So you and I, Mary, could decide to start a company today that we want to sell a supplement for eye health. So what would we have to do? We'd have to source the raw materials, maybe from Mexico, or if it's Omega, we'll source it from Norway. And we would ask an encapsulator to encapsulate it, and then we'd ask a labeler to label. And then we'd have to provide to the Food Safety Authority in Ireland the appropriate documentation to say, here's what we're doing, we're not making false claims, here's what's on the label. But what we found out is that, unfortunately, based on our research to date, there's not enough testing done of food supplements. So in other words, we might be able to provide a cert from the provider that says it has lutein, but then the question is, who's checking that? And who's not just checking it at the start, who's checking it on the journey of the food supplement 6 months later or 12 months later? Is the supplement still active? Does it still have the same materials? And the answer is, we've seen, taking the eye supplements for example, about 70% of those do not have in the supplement what the label claims they have. That's what our own research has shown. So that's why Supplement Certified exists, because knowing this, one of the collaborators that we work with in Ireland, a company called MacuHealth, so we would be testing in our clinical trials their food supplements. Because we were able to test their supplements and we could see that their product is very stable, it contains exactly what they're saying.
Does what it says on the tin.
Does what it says on the tin, exactly. Yeah. There was an opportunity to do this for loads of other companies, and thankfully we have loads of companies now that are coming to put their product into that. But it's kind of, at the moment, right, here's the issue, it's kind of self-regulated, because no one forces those companies to do that. They do it because they're quality companies, because they have quality products. And you know, it's the Macu Prime supplement that we see here in Ireland, for example, that is not just tested clinically, but now it's part of the Supplement Certified piece. And
are you the only company doing what you do then? Are you the only company who are testing supplements to see does it do what it says on the tin, basically?
Yes, that it contains what it says on the tin.
That it contains what it says on the tin.
Okay, the doing bit is the efficacy bit, which require. I always say there's two things you need to have. One is, you see all these claims, you and I spoke about it before this interview today, you see all these claims on across all media platforms, this supplement will do A, B and C. The only way you know if that's true is if that particular supplement and that particular formula has an evidence-based clinical trial that proves that it's good, that it increases, for example, the protective pigments in your eye, and that means that you get better vision, or that means you're less likely to get macular degeneration. So that's one piece. The second piece is really where Supplement Certified comes in. So let's just say you get that right. And you're selling a lutein supplement or an omega supplement. The question is, does that supplement contain the exact amounts? I use the egg analogy, right? If you go to the supermarket to buy 12 eggs and you go home and you open the carton and there's 8 eggs present, what do? You're not happy, right? I think my mum would go back and look for her eggs.
Depends on how close the shop is. I might just give out stink.
Right.
But, we all should go back. Yeah.
But isn't that an interesting analogy? Because with supplements, you can't look inside the egg carton. We have to take it for granted what they are saying. Now, we've all been reared in a world where you go into a pharmacy or into an eye clinic and they're selling you something that says, here's a carotenoid product for your eyes that contains X amount of lutein. You kind of accept that someone is looking after us. And I think Supplement Certified is there to kind of validate or check for companies that are doing that correctly.
And I suppose it's really important to say that this is not prescription drugs. This is supplements over the counter.
Yeah. Very good point, Mary.
Yeah.
They're over there and they're treated like foods, which accept a lot of variation. But, we would argue that if my mum, now she's one of the customers, I keep referring to my mum, pays her money to go and buy a supplement that a healthcare professional has recommended that she goes and get because she might have early macular degeneration, which she does, by the way. She's very much entitled to get those 12 eggs, and in the case of the carotenoids, to get all of what she's paying for.
So my next question is then, somebody goes through the Supplement Certified process. So I've decided to create a supplement and I want everybody to know that it's legit and it contains what the label says it contains. Do I get any kind of a little tick or a Supplement Certified logo on my product then? Like how does the consumer benefit from this, I suppose? In terms
of how do they even know?
How do they know?
No, another great question. So yes is the answer, and it's one of the parts of what the company has achieved. We have now an internationally recognised trademark of a Supplement Certified logo. So companies that come onto the programme that commit to have their products sent to us from creation, and every time they create, for label testing and stability, will be issued the use of that certified logo, the Supplement Certified logo, the SC. Okay,
brilliant. We're kind of coming close to the end of the interview, unfortunately, because it's really interesting, but I do have some more questions. I suppose in terms of the business then, so you mentioned that you've got 6 people and growing. Where's your client base at the moment? Is it mostly Ireland or is it global, or what's the story there?
So we've Irish companies. The Irish companies, I don't mind mentioning them, Macu Prime, Remind. We've American companies as well. A lot of our customers would be in America. Germany, we've customers from Germany. Now I should mention, if you go to our website or if you inquire, we'd be very happy to tell you. It depends on the bioactive. There's another vitamin C, heights. So we do more than just eye carotenoids. So there's different companies doing different pieces with us. I'm
right in saying you kind of started out kind of exclusively in the eye health supplement space, but that's kind of broadening out now, and I presume you're hoping that will broaden out from a business perspective.
Yeah, exactly. And look, that's one of the gaps we have to fill. There's 2 things we need to do.
Yeah.
One is that our lab is wonderful, but thankfully our hard work at the moment is adding to our capacity. So when you look at, it's Supplement Certified, it's not eye Supplement Certified, that we can do protein, we can do creatine, we can do all the different bioactives that people believe that they're getting value from, and at the very least validate that it's there. So we'll be growing the analytical team and the analytical capacity and partnerships within that. And the big thing that we do, I think that's really important to us, is our scientists submit our program for what we call ISO certification. So it's totally independent. once the supplement comes into our platform, it's treated with that independence, and we're audited by an outside body to make sure everything we're doing has a unique procedure and that the results are bona fide, that they stand up. And we're doing it to protect the consumer. We're doing it to protect the consumer in this world where I believe we need to be consuming on top of really good nutrition. I must say that there are certain bioactive supplements that will allow us be healthier for longer.
Okay.
But there's a gap to protect the consumer.
And I suppose that brings me to my final question, because you've mentioned a couple of times in this interview that it's a poorly regulated industry, the supplement industry. And I think there's a whole broader conversation about the wellness industry in general, but we're specifically talking about supplements here. So is this something in the long term that you could maybe work with the Irish government on then, in terms of bringing in better regulation?
Absolutely. Like, we have a full PhD programme running at the university, like actually writing a whole dissertation on the regulatory environment, right? And so if the Food Safety Authority of Ireland were sitting here beside me, they'd argue that they do lots of really good things, and they do. I mean, but a lot of the work so far within the Food Safety of Ireland is looking at labelling and making claims that you can stand over. But I have had conversations with them, and indeed with government, about the requirement to... Can I make an analogy? It's like me saying to you, Mary, I think you should tax your car. Because if you tax your car, it means that we're going to have better roads and traffic lights and everything that we need to operate in a safe environment. But imagine if I said to you, but you don't have to. The question is, would you? And you can apply that here to the food supplement industry. Right now, people are supposed to do certain types of testing, and they should enter themselves into programs like Supplement Certified, but it's not mandated.
Okay.
So they're not going to. So right now, that's why I say it's self-regulated. There's certain documents that have to be submitted to the Irish government in order to trade. That's a given. But there's nobody really looking under the bonnet in terms of, testing the supplements.
It's such an interesting point, actually, isn't it? Yeah. And then I suppose a lot, and again, I need to wrap because we are out of time, but a lot of people are kind of buying supplements in good faith because they were recommended by pharmacists or GPs and that. So there are medical people, I suppose, who are recommending supplements in good faith as well.
I think that most of it's done in good faith, and very good professionals doing that. Yeah. But I would say we need to help the pharmacists, and we need to help the medical profession. They have to get an education around food and food supplements and what can go wrong. Remember what I said at the beginning, 70% of supplements do not have in the supplement what the label claims. That's a statement of scientific fact that we know. That's why we exist, and that's why we're going to work to protect the consumer and the very good companies that want to invest in the quality programme that is Supplement Certified.
Brilliant stuff. We are officially now out of time. Supplementcertified.ie, and it's supplement singular word, so supplementcertified.ie is where you'll find out more. Professor John Nolan, well done to you and all your team on the great work you continue to do.